Hello everyone. I hope you are having a great July. The summer is here, the warm weather is here, and there's so many good fruits and vegetables for us to be enjoying these days. I think most of our farmers markets have started or are in full force right now, and often that makes you feel inspired to want to try new recipes or even a new food. And if you're living with kidney disease, maybe you're like some of my clients that I've worked with over the years, you've just been given a piece of paper. And I can't tell you how many times this breaks my heart to hear that, I was given this piece of paper and it tells me to avoid all of my favorite foods or some of those foods that I'm able to get access to. And it shouldn't be that way because with kidney disease, we really want to focus on what foods we can include and how we can incorporate these really, really healthy foods. So I'm happy to be chatting a bit about this topic tonight because I think that as we start to, find foods and look at new foods that we can include in our diet, we maybe just need to modify some recipes or find a cookbook that's going to help support our eating. Because when we think about kidney disease, gone are the days where we focus on taking things out or avoiding things in our diet. So it's really important that we start to focus on the foods that we can eat with kidney disease. So really happy that those of you that are here, maybe you're interested in cooking, maybe to get us started, just send me a yes or a no if you're interested in cooking in the comment section, because certainly we're going to talk a bit about cooking. I'm a dietitian. I love eating. I love cooking. I love talking about food. So I think tonight will be a good chat. For those of you who are new in this group, because our group here, the Kidney Support, Nutrition, Recipes, and Tips for CKD are always growing. I will just introduce myself. My name is Emily. I am a registered dietitian and certified diabetes educator. I am the admin, I am the curator of this community, and really the goal is for us to talk about nutrition, recipes, and tips for kidney disease, because, when we often are navigating that complex world of kidney disease, there's some dietary restrictions, and we want to preserve our kidney function for a really long time. We want to also make sure that we are managing any other health conditions we have, but also not giving up our favorite meals. And so this topic is so fitting for our group here. So let's get started. When we have kidney disease, it definitely doesn't mean giving up our favorite meals. Sometimes it means getting creative in the kitchen. We can modify different recipes to really ease the burden on our kidneys or reduce them from having to work harder. So we can lower things like the sodium or the protein, or if we have diabetes, maybe we also reduce things like the sugar. So I want to talk about a few tips that we can do to modify recipes, and then we'll talk about finding some cookbooks and recipes. So sodium is something that everyone with kidney disease is often concerned about because too much sodium increases our blood pressure, can lead to fluid retention. So we really want to try to reduce these. And, we've talked about sodium recommendations, 1,500 to 2,000 milligrams, so less than a teaspoon of salt. It's really going to depend on your health, your blood work, your specific needs. And so speaking with your healthcare provider or your dietitian for how much you should be targeting is important, but that's kind of that general recommendation. So instead of salt, try to use different herbs or spices like garlic powder or onion powder, basil, rosemary, lemon zest. Try to avoid the blends though, or the reduced salt things. So things like MSG or new salt or half salt, they sometimes will also have potassium chloride in it. So it's better to just choose those herbs and spices. Rinsing our canned beans and vegetables can actually reduce about 40% of the sodium. There are no added salt products out there though, but if you can't get your hands on them, then that's okay. When we cook from scratch, we often will be able to reduce the sodium. So 1 teaspoon of salt, that has about 2,300 milligrams. It's the same amount as that tip of our finger. And so when we're cooking, we can automatically reduce the amount of sodium in our food. Protein, I think, is the other big thing that we think about with kidney disease. And we want to try to reduce that portion size of animal protein. So, when we're cooking at home, we can scale back on the size that we cook for ourselves. we could maybe make plant-based proteins more prominent, so use lentils or tofus. If you're, making like a ground meat dish, you could put either of those in and you wouldn't notice. Substitute for non-dairy beverages like almond milk or oat milk or rice milk as opposed to using cow's milk. That will help to reduce the protein. And try to stretch meat by using low protein ingredients like rice or whole grains or vegetables to give you more bulk to it. Um, when you're reading food labels, you can see for things like how much sodium is in it, how much protein is in it. You can also check for things like sugar or potassium and phosphorus. So keeping an eye out on those is really, really important. And, we can take each of these pieces based on whatever our kidney health really needs. And when we know our guidelines and our parameters, we can think about what a meal might look like. So if our target for sodium is 2,000 milligrams per day, if we have 3 meals and a couple of snacks per day, maybe we aim for about 500 milligrams of sodium per meal. Similarly with protein, if our target is 65 grams of protein per day, maybe we have 15 at breakfast, 20 at lunch and dinner, and then we have 2 snacks of 5 grams each. So we can kind of modify our recipes to meet with that. So when we're cooking, for protein, if we have if we have the nutrition information of a recipe and it's 4 servings, but it meets the sodium and the potassium, but it doesn't meet the protein, maybe we stretch that and we have 6 servings out of it. So you can do a little bit of math there to help. Similarly with sodium, you know that 1 teaspoon is 2,300 milligrams. So if you just take out that salt, how much is going to be in that recipe still? That allows you to look online for different recipes and use a variety of recipes or a variety of websites to see how you can incorporate them. So I love, recipes like All Recipes website. They often will have the nutrition information. There's always the Kidney Community Kitchen, the National Kidney Foundation, DaVita. All of these kidney websites also have like kidney-friendly resources, but you could use like All Recipes to search for low sodium or vegetarian options and read that kind of nutrition information at the bottom, because then you're going to get a lot more variety in those meals. If you like cookbooks, certainly I have a few out there that you could pick up if you were interested in. I have one for those who are with chronic kidney disease, someone who has chronic kidney disease and diabetes, and then I also have a book for those who are caregivers. It can be really helpful. So when we think about, what we look for in a cookbook is, look for one that has recipes that are achievable for us to make, right? We don't want recipes that are going to have, 101 different ingredients in them and things that we don't often have. So, those exotic or those difficult to find products that can really make preparing a meal complicated and also expensive, right? So looking for a cookbook that has ingredients that you already are purchasing or already have at home can make it a little bit more accessible. If the cookbook also has some sort of educational information, that can be really great. So things like meal planning or, a kidney-friendly diet or food substitutions or how to learn about eating more plant-based. That can be really, really helpful, and it's kind of a nice bonus in our cookbooks instead of just getting the recipe like we do on some of these websites. The recipes should have a variety, right? You want some breakfast, some lunch, some dinner, some snacks, some desserts. Having that kind of diversity in the recipes as well is really helpful. We don't want one that's going to have like 20 sauces or seasonings in it, but no really content in it. And of course, one that has the nutrition information. So that allows you to be in control of the sodium, the protein, potassium, phosphorus, whatever is important for you. That having that information available for you right off the bat is super, super important. So certainly, I have written a few cookbooks. If you are looking for something with more of a kidney focus, if you're looking for more of like a Mediterranean focus, there's lots of options out there as well. But really, like, you want to choose things that are based on your dietary needs, right? So if you're looking for potassium recipes, try to find them that, are maybe around that 500 milligrams. So I see that breakdown of protein was really helpful. So maybe we'll talk about it in kind of a potassium perspective as well. If you're following a low potassium diet, you have that 2,000 milligrams per day if that's your target. Again, we want to break that up into meals. So, 500 at each meal, and then that still gives us some for snacking. Maybe your needs are batch cooking, right? So maybe you're okay eating leftovers for a couple of days, but you want to be able to prepare, cook once, and eat for a couple of days. So maybe you look for a recipe that allows you to have dishes that can either be scaled up, but also dishes that are going to freeze well. For example, a salad. A lettuce salad, not necessarily going to freeze very well, but maybe you can repurpose it. So, for example, last night I had a roasted veggie salad. I often will do like a leafy green. Sometimes I'll do some barbecued vegetables, so like peppers and onions and zucchini or mushrooms, whatever your kind of diet needs are. You could always modify those for lower potassium. And then I used spinach last night, but you could use arugula. And I didn't finish that whole salad I made, so tonight I put it into a frittata. So, you can repurpose some of the meals that wouldn't necessarily freeze well, like a salad, into something else. But if you're looking for, batch cooking options or meal planning options, look for that in a book. Or maybe you're looking for ones that are quick and simple. Or maybe you're looking for things that are your favorite recipes that you just really want the nutrition information. So those are kind of the other really nice ways to think about when you're looking for a cookbook or you're looking for recipes, what else you want to keep in it. So, and if you are batch cooking, definitely, food safety is important. So trying to make sure we're eating the leftovers within 3 to 4 days. That way things we don't get any bacteria, we don't get sick from them. Because food safety is super important when we have kidney disease. We don't want to get foodborne illness and then we get sick and dehydrated, and that's not good for our kidneys. So, I have a little tip sheet here for you. Awesome. Glad to hear some of those here batch cook. So yeah, you can purchase them on Amazon. I don't sell them personally, but that is a great question. Thank you for asking. Unfortunately, I don't have the infrastructure to have a warehouse of cookbooks, so Amazon offers that option for sure. But certainly, like, my cookbooks are great resources, but there are a lot of free ones out there too. So on my blog, I have quite a lot of recipes. On my can share how you find them on my blog. There's a tag you can just click. It'll pull up all of the recipes. Certainly, we share a lot of things in this group as well. So I think a lot of opportunities to get resources that are kidney friendly and also choosing a variety of things. So hopefully this was helpful, giving you some ideas of, next time you look up a recipe, things to look for and strategies to change. But remember, nutrition is something that can bring us a lot of joy. It shouldn't bring us a lot of confusion. If you're feeling confused about it, feel free to reach out. Our team is here to help. We have one-on-one services for those in Canada. We also have our online courses and programs if you're looking for more support through a virtual forum. So thanks so much for joining, everyone. I hope this was helpful. If you have any questions, feel free to connect. If you're looking for any kind of nutrition recommendations, always speak with your healthcare team before really making anything. But hopefully this gets you on the right track and gets you back into the kitchen, enjoying some of those delicious vegetables and fruits that we have in season right now. So thanks, everyone. Have a great night.